dislocated upper esophageal sphincter.
You have a good tumor margin resecting above or below?
Below.
Shaun gave the news to his patient after all.
Shaun did what I expected. He upset her, but the news is upsetting. She'll deal with it. He'll learn how to...
She wants him off the case. Shaun.
No.
Shaun, I will find you another case.
This is my case. I prepared for this case. I don't want another case.
Dr. Murphy.
What are you learning, Shaun? That's what you do at a teaching hospital. I'm learning too. Going from attending to chief of surgery is a big deal. Every day, every decision, every mistake, I learned something. So do you.
No, I don't. I have a developmental disorder.
Come with me.
I'm waiting for my bus.
You can take a later one. I'm sure I mentioned I was chief. Hi, Beth. I'm sorry for what you're going through. And Dr. Murphy's phrasing was unfortunate. But there's been no deceit or negligence. He's an excellent surgeon who has my full confidence in the OR. And if you don't trust him, you don't trust me. So I would recommend you have your surgery at a different hospital. I can make arrangements. However, if you reconsider, we can proceed as scheduled first thing tomorrow morning.
Hey, I was looking for you. Big day, huh? How your nerves holding up?
I'm not nervous.
Of course you're nervous. Everybody's nervous. It just means that you care.
Being nervous means I feel inadequate and unprepared, and if I am either of those things, it doesn't matter whether I care or not.
You are more than adequate, and you're very prepared. You remind me of a young surgeon I knew once. The day he got his first lead, he was thrilled, but he was a mess. Trying to remember a million things, imagining a million things that could go wrong. But then he remembered the birth process, how moms are asked to pick a focal point, let everything filter through that. So he chose the color orange to focus on. This is the cap that he focused on, and he got through it with flying colors. Maybe it'll help.
Why do you have the young surgeon's cap?
I was being coy. The young surgeon was me.
Sorry, Dr. Andrews. I had a patient with some post-op arm pain. How can I help you?
What's happened to all the nurses?
Hello, my name is Dr. Shaun Murphy, surgical resident, year 3. I will be assisted by Dr. Claire Brown on today's open appendectomy. I will not be putting on my number 7 sterile gloves myself, as I am lead surgeon. Nurse Fletch, can you adjust the overhead light?
How many degrees, Dr. Murphy?
Yes, I should be more specific. A 35-degree angle. Nurse Hawks, please hand me the 10 blade. Straight clamp, please, Nurse Fletch. Hello, Dr. Andrews. I'm going to try to pretend you're not here. You have not pretended to scrub in and may not be here when here is there. They're being OR2 later today.
You don't need a full surgical team to rehearse. Some of the staff needs to get back to their stations.
No, they can stay here. Chief Lim has assigned me my second first surgery, and she assigned them all to me and told me to rehearse with all of them, unless and until there's an emergency on their floor. Dr. Brown, please hand me the Bovie.
Dr. Brown had a dental appointment this morning. I'm doing my best to be annoyingly caring and empathetic in her stead.
The appendix can be removed in various ways, including suture ligation, purse stringing, and inversion appendectomy. I will be using the suture ligation technique. Dr. Brown, place a clamp just proximal to the distal ligature on the appendix.
How's it going with Carly?
Divide sharply and cauterize the exposed mucosa.
Isn't dating life wonderful? Everything you hoped it would be?
Please refrain from asking non-surgical questions, Morgan. I need to concentrate on the next step in my OR management.
And I need to be clear. Is there any chance she's not going to be concerned about your personal well-being and inquire repeatedly?
Things are going well, Dr. Brown. We make out a lot. Let's close the peritoneal cavity.
Did you guys have lots of fun on your last day off?
I went to the museum. Nurse Hawks, please check the patient's vitals.
Everything looks normal. You went alone?
I called Carly at her house to see if she wanted to play Chinese checkers. Close the external oblique fascia with a continuous tuovicral stitch, although they're not really Chinese. It's actually a game of German origin called Sternhalme. It's very fun. I will use 4-0 monocrol subcuticular interrupted sutures for skin closure. However, Carly said she could not hang out because she was busy. If the wound was contaminated, we could leave in a Penrose drain and remove it 2 to 3 days later, but it is not. She had friends over. I could hear laughing in the background. Dr. Brown, approximate all split muscle layers.
That's odd.
Nothing is odd. We just have 2 more steps and
No,
then...
that whatever she was doing, she didn't invite you.
Why?
She isn't treating you like a boyfriend. You don't exclude your significant other from a get-together.
That's not true. It could have been a family thing.
Or maybe she thinks it's too early to introduce you to her friends.
It's also possible that there was no get-together at all. I mean, maybe you just heard the television.
Maybe she just doesn't see you as her boyfriend. Has she ever called you her boyfriend?
We have practiced enough.
Hey, Shaun.
Hello.
Waiting for Carly?
I want to know why she did not invite me to her get-together.
Might have a better chance of finding out if you were physically closer to her.
Maybe later.